Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we welcome Mark Cuban, co-founder of Mark Cuban costplusdrugs.com. Thank you so much for being here, Mark.
Thanks for having me.
I am so excited to talk about this because pricing is the one thing. I mean, there's many things in healthcare that need help, but pricing is so just all over the place and nothing seems to be tied to data. There's no real reason other than middlemen for why these drugs are so expensive. So tell us, how are you disrupting this industry?
I mean, you hit the nail on the head. There's no good reason for prices to be what they are, except for the middlemen. And those middlemen have become vertically integrated into larger and larger companies, which allows them to distort the pricing, be the opposite of transparent, be very opaque, and that created an opportunity for us. And the idea of being able to change the whole methodology of drug pricing in this country was very appealing to me. It's just something that when you get a chance to have that big an impact on that many people, how could I say no?
You launched this in January. It looks like the company was actually founded in 2016, but the pharmacy officially came online in January of this year.
Right. We started working on this, 4+ years ago. Dr. Oshmayansky and I, based off a cold email that Dr. Oshmayansky sent me, talking about the problem of pricing with drugs, and I was like, asked him a bunch of questions, and I was like, let's go, let's figure this out. And it took us a long time to get all the I's dotted and T's crossed, because for good reason. There's a lot of regulation, there's a lot of licensing, there's a lot of things that have to take place before you can start selling drugs to consumers or to businesses or insurance companies or anything. And so we went through that process, and it took us the good 4 years until January 19th of 2022, when we launched costplusdrugs.com.
That's fantastic, Mark. So you mentioned you're obviously not afraid of disrupting the industry. You're going right after it. But are the middlemen fighting back? And can they block you from access to certain medications? Are you worried about that at all?
They're not fighting back quite yet. They've talked about it, but they kind of laugh at us because we're relatively small to them compared to them. But we've heard some things where some of the manufacturers are concerned that they might get dropped from a formulary, or there might get their prices raised. But for the most part, the point we've made to the manufacturers and distributors is that, look, the manufacturers are more often than not, incorrectly painted as the bad guys when it comes to drug pricing. That, whether it's insulin or whatever it may be, the prices that they make available to these middlemen are typically relatively reasonable. It's just what happens next that distorts the pricing and really creates problems for patients. And so we told them that we're their best ally, that my platform is their best ally, because they've been so incorrectly painted as being the cause of this problem. And with my platform, I'm more than happy, just like I'm doing right now, to say otherwise.
Because right now you mark up, it's the wholesale price plus 15% plus a $3 pharmacy fee, and then typically a $5 shipping fee. Is that correct?
Correct. So whatever we pay, we show you right on the site. So whatever the drug happens to be, you can go look it up and you'll see our cost. You'll see the 15% markup, and then you'll see the $3 True Pill pharmacy handling fee, and then the $5 shipping. And the good news is it's almost always the lowest price available. And the better news is it's almost always cheaper than most people's copays.
That's just unbelievable, Mark. So I went to the site and I saw you have like 100+ drugs already available. Most of those appeared to me like they were generics. So are you planning to do the same thing with brand name drugs too? Is that the same equation?
Yes, we're in negotiations with a lot of manufacturers of brand name drugs, distributors of brand name drugs. The goal is to be approaching 2,000 drugs by the end of this year.
Wow.
Yeah. And then you also have a factory that you broke ground on. And so how do things change with that? Because you have this partnership with True Pill, will you still be using them, or are you able to then become completely self-sustaining once this factory is open?
No, the approach with the factory that we're building in the Deep Ellum section of Dallas is that we want to be able to do injectables and drugs that typically have shortages and that are hard to come by, and make them not only available to patients, but just as importantly, available to hospitals. Because what happens often is that there are shortages, or the pricing when there are shortages just gets inflated significantly. So we intentionally chose drugs that to make first that are that we think we can have the greatest impact, not only on pricing, but on equity. Meaning, the people who have the hardest time getting important drugs will be able to get them. And then the plan is also very expandable, and it's driven by robotics. And so we'll also be able to extend it so that, we'll be able to make, a year's worth of supply for ourselves, then change it over to another drug, and then another drug, then another drug, and then rinse and repeat.
So Mark, will those drugs then be only available to your pharmacy, or will you actually be?
No, we'll sell them to everybody. We'll sell them, yeah. So we have our own PBM, and we'll sell to insurance companies. We'll sell to self-insured companies. We'll sell to unions. We'll sell to teachers unions, everybody and anybody. We're not trying to limit this. We're trying to have an impact.
Was there something, Mark, about healthcare that made you say, you know what, this is the opportunity, I'm going to go after it? Do you any personal story in that regard that made you particularly think, hey, this is it, my opportunity?
Yeah, well, I mean, we all have personal stories, in our lives. But really, what led me to really diving in on healthcare was when there was discussion of ending the ACA. And I was talking to people in Texas who were Republicans, and I was like, what are you going to replace it with? And nobody had an answer. And it was just like, let's just get rid of the ACA and we'll figure it out later, which obviously is ridiculous. And so I started digging into the nuances of healthcare and healthcare pricing, funded some studies in terms of cost administration of contracts. I did, one study that's ongoing. I asked a simple question. I said, look, in Toronto, the real estate in downtown Toronto is more expensive than in downtown New York. The doctors get paid the same, the nurses get paid a little bit more in Canada, Band-Aids cost the same, beds cost the same, etc. For the 35 top procedures, a hospital in Canada can charge less than we charge for Medicare. And that made no sense to me. And so I started digging in and really understanding how costs work, not just on the pharmacy side, but also on the hospital side and the provider side. And then as I started talking to Dr. Oshmayansky, I brought up the case of the pharma bro. And it was like, well, if he can increase prices by 7,500%, then there must be an opportunity for us to reduce prices just as significantly to get closer to cost and just be just as disruptive, only without the greed. And that also led to us really digging in, and really was the impetus for us starting costplusdrugs.com. Wow.
So Mark, one question I have for you then is that there's a lot of talk these days about price transparency in this country. And I just wonder based on what you found with Canada, is there just greater price transparency there versus here? Is that part of what's leading to
Yeah, I mean, one of the studies I wanted to do was to go to all the top hospitals across the United States and just ask them how they do their cost accounting. Nobody would have participated. Nobody. And, when you read, and, I turned to somewhat of a hospital geek, or as a healthcare geek, and, and when you read some of the MedPAC transcripts, where they, when they have to make decisions on how they're going to do increases of pricing from benchmarks and the like, you start realizing that they don't really have a foundation in understanding the costs that providers have. And then when you go to some of the conferences and you talk to providers, they don't even truly know what their costs are. They're just on a mission to get bigger, and that is an incongruence with having low cost provisioning of healthcare. And so all these things just came together and really got me interested in pricing across the board.
You're completely doing something totally different than everybody else is. So there's all these other companies, Walgreens has their online thing, and CVS, and Amazon has a pharmacy. What makes you different? Why should people go to you? Now, it seems obvious because the pricing is clear, but you're still, when you're competing against Amazon, how do you get people to realize Amazon's not always better? It's great for 2-day shipping on some things, but not on your drugs.
Yeah, when you run with the elephants, there's the quick and the dead. And so we have to be very agile. And the good news is, and one of the reasons we're able to do this is, when people have illnesses, they tend to participate in the same communities. Those with, leukemia or whatever form of cancer or whatever illness they may have. And when you provide a drug at a lower cost than their Medicare, their deductible, or their copay, they tend to all speak to each other. And that creates unique opportunities and makes it very viral. And that's what's happened with us. So we don't spend any money on marketing. We don't spend any money on advertising. You don't have to be a Prime member. You don't have to be, have insurance. You don't have to have a discount card. You don't have to pay a membership to find out where your discount card, and you don't have to wonder which Walgreens or CVS you're going to go to today to get to the lowest price. It is always just consistent and transparent. And when you simplify and offer the lowest cost, people tend to tell each other. And so to answer your question, that's our secret sauce. It's just very simple, very transparent, and nobody else is willing to offer that. And then there's a second part to that as well. There's a lot of companies that have done a good job of using discount cards to help patients find lower cost options. But they're part of the system. They're not outside the system. They work with PBMs, and it's kind of a gaming of the system, but their mission is still as a public company, or they still have an obligation to shareholders. I'm the only investor. I put up all the money. I'm willing to eat a lot of money because this, we hope this to be a game changer. Knock on wood.
Have you heard from any people who have used this and it's just completely transformed their lives? They're able to comply with medication, get the medication, and start taking it?
Oh yeah, all day, every day. Between emails, and I'll tweet a bunch of them or retweet a bunch of them on Twitter or LinkedIn, where people are like, in tears or crying or upset, or, that they don't have to ration their medication. They don't have to make, a choice between eating or paying their rent or whatever it may be. And, just examples of people paying $1,000 a month, for a drug that we have for $30 or $6. It's just insane, but it's not an efficient market. And you can't expect, a 70 or anybody for that matter to all of a sudden, be the ultimate consumer. And even though you can do a search for lowest price on, fill in the drug on Google or elsewhere, it's still difficult then to follow through on all the items you have to do just to get that lowest price. So we want it to be very, very simple. You go to costplusdrugs.com, you set up an account, it's free. You answer the traditional questions so we can look for conflicts and contraindicators and check that, or have the pharmacist check that. And then you see the price, you see the cost, and we then give you a fax number or phone number or email, most likely, to send the RX. We take the RX, you place an order, that's it, it shows up.
My dad was definitely one of the people that could have used this. Unfortunately, he died a number of years back, but he was diabetic, took insulin and all kinds of other things. And one day he dropped his insulin in soap water. I don't even know how that happened, but it did. And he didn't want to tell anybody that he didn't have it. I guess he was embarrassed to tell that story. So he just wasn't taking it. He was rationing it, like you said, because he couldn't afford to get more. And nobody should ever have to be in that situation, which is why companies like yours are so important.
Yeah, it's horrific.
It's unbelievable. And, it's like, you don't think that's like, it sounds like something that would happen, to somebody you don't know. Like, that's a story you read about, but like, that was my dad. And I was like, what do you mean you dropped that in the sink? Why didn't you tell anybody?
No, it's like my mom. We couldn't give my mom before she passed to take her medicine, right? And just the games you have to play. She had cancer and she needed a PET scan. She was in the hospital, and we said, can we just have her while she's here, because she's frail? We don't want to have to bring her back. Can we have her get a PET scan now? And they were like, no, because of insurance and the way it works, you have to bring her back in a week. Well, it's just ridiculous.
Taking insurance either, Mark, and that's interesting. Is that a strategy you're going to pursue and continue to, or do you think at some point you will start accepting insurance as well?
No, we're not opposed to accepting insurance, but they have to adhere to our pricing. And so the insurance companies that are vertically integrated with PBMs and retail pharmacy chains, they're not going to work with us. But there are a lot, like some of the mid to decent sized insurance companies that just want the lowest cost drugs and aren't happy with the PBMs, the non-vertically integrated PBMs that they have to work with, see as a potentially better alternative. And we're talking about with them about, in one case, I think it's $4 a month premium and all your drugs are free. It's just because they can cut. We want to work with the insurance companies that align with not only the medical interest of patients, but also the financial interest of patients. And if they're willing to do that, we're more than happy to work with them.
I've got a couple of questions for you, Mark, on the strategy side. It's interesting because you're the consummate entrepreneur. And I guess the common wisdom I've heard as an aspiring entrepreneur is don't compete on price. Competing on price is a race to the bottom, yet you're right out front competing purely on price. So how do you reconcile that for a lot of would-be entrepreneurs that are listening as to what are they going to learn from you as the entrepreneur mentor for all of us?
Well, two things. One, go out and make a few $1 billion and you won't have to worry about it. But two, the beauty of capitalism is you get to define your own reward. It doesn't necessarily have to be financial. And as an entrepreneur, I've been through the grind. I've won and I've lost. I've failed. And I've reached a level of success where I can change the rewards that I look for as an entrepreneur. And in this particular case, disruption is the primary reward, knowing that, if we can scale big enough, to paraphrase Jeff Bezos at Amazon, your margin is my opportunity. And if we can scale big enough, then we'll create profits and we'll be able to reinvest them. But as the only investor, my goal wouldn't be, okay, let me make as much money as I can. If we're making money and we're able to invest in new opportunities, that's great. But it's also an opportunity to lower our prices even more.
That actually leads to my second question, which you just mentioned. You've talked about disruption. Clearly, that's what's motivating you here. Is it your view that you can only disrupt from outside? And I asked that question, I'll just preface it again by saying, I'm a consultant by day. I work with healthcare industry. We're trying to help make them better from within, what we call care transformation. But, what's your view on that? Is it ultimately only going to happen by companies like you that come in from the outside?
Fortunately, no, not at all. But you've got to be able to break down the traditional barriers of the way things have always been done, particularly for providers. You can't expect insurance companies to, all of a sudden become transparent. That's the antithesis of their business. But there's no reason. You're seeing some providers, some surgery centers, I think it's called an Oklahoma Surgery Center or whatever, who are completely transparent. The challenge is, it's very hard to shop after you've just been in an accident or whatever. And so to challenge and disrupt from within, it's about saying, okay, one, when we post our prices, if you're a hospital on your website, it's not in a format that's hard to use, right? You want to really, align yourself with the patients. And two, why shouldn't a hospital be completely transparent? There's a lot of hospitals, providers that have become part of conglomerates that, are owned by private equity. That's a difficult set of circumstances because it's going to be very difficult for them to align their interests of making money with the interest of a patient of getting the best care possible, hopefully at the lowest possible price. So it's not that it can't happen, but it's going to take somebody who's very disruptive, and it's going to take ownership, who says, look, I'm okay if my stock price is not the highest that it possibly could be. And I'm okay if I have complete turnover in shareholders. If you believe in our mission, then come on and take it with us. If you want to be a shareholder in a company that is changing how hospitals provide care and at a much lower price, it takes those types of things to disrupt. Otherwise, it's always on the margins. Here we are, we have this program that allows us to provide this service better. We have that program that allows us to use social determinants of health to give us better outcomes. We're using this capitation program to reduce this cost or to provide broader base of care. And all those programs are great. And working with those programs to provide better care are great, but they still ignore the underlying issue for providers. And that is lack of transparency. And even worse, most providers don't even know their own costs and couldn't assign a cost, for the services and procedures they're trying to offer. And, when I've thought about doing a hospital, if this succeeds, if I ever go in that direction, why not make it, completely transparent and, just say all my costs divided by 0.85 divided by the number of services we offer, whatever it may be, right? So that it may be more expensive in some cases because it's not subsidized, it may be less expensive, but it certainly would not be a set of circumstances where, there's a blueprint in the CEO's office, where the blueprints are in CEO's office to look to build more. To me, anytime you see a hospital adding more buildings, they're not putting customers first or patients first. Now, they might argue with that, well, we need to have this new cardiac center. We need to have this new, machine that goes ping, and that's all potentially true. But in any given city, you don't need 5 leading cardiac, centers, right? Or 16 orthopedic centers, that we're competing on the wrong elements in my mind.
It's interesting when you were saying that about building more buildings. It reminded me of something that Howard Stern said whenever he switched to Sirius. He said, in the traditional radio stations, he said everybody has the offices. And he's like, everywhere I've been, every time I see more offices, I know there's just, more bureaucracy. Nothing good ever comes out of, just building more offices. And then the other thing that struck me was, when you're talking about healthcare and the costs and lack of transparency, I mean, it's so similar to buying a car, it's a dance. And, if you're not really fully aware of all of the things you're dealing on, you ultimately have no power because there's no anything. It's just you're going in blind, trying to figure it out. And you have to be skilled. And we can't reasonably, in emergency situations, expect people to be doing that.
Well, you're exactly right. But even on top of that, if you look at the way insurance is structured relative to providers, they redo their contracts every 1, 2, 3 years, which adds a whole new layer of administration and uncertainty, and it requires more administrators to deal with the contracts, which is why 21% of what we spend on healthcare in this country is administration. Just the simplest things like a standardized contract, a standardized term for all contracts. Like in the NBA, all players have basically the same contract. There's just some, you change the amount guaranteed, you change the amount that's earned by the player, but there's standard player contracts. In most industries, they use standard contracts. That I'm aware of, nowhere in healthcare is that the case. So if you want to come up with something that'll just reduce that administration cost from 21% to 20%, which is billions of dollars, require a standard contract, require a standard term, ding them under the ACA on the medical loss ratio, because I understand why they did it that way, and an 85% and 15, but the reality is that means that the interest of the insurers, the payers, and the providers are aligned, but they're not aligned with low cost with the patient, because net 15% of a bigger number is a bigger number, and that's the business they're in. And so while it was a nice change from what it was before, we still have a long way to go, and it's all basic math and transparency. We just, going back to Dr. Gupta's question, it's hard to change from the inside if when you're inside, you still don't even know your costs. There's still no transparency to the inside. I don't even know if CEOs of hospitals have full transparency in what their costs are.
Yeah, they don't, unfortunately. So Mark, isn't that ultimately what you were just saying? Isn't that also still another version of capitalism at play? And let the best insurance company win. What's preventing the market from really rewarding those people that get it right versus not? I mean, there's something horribly wrong with the market, but I'm hoping you as a disruptor may have some interesting thoughts on that. What is preventing that market from aligning?
Well, one is scale, right? Because there are health companies that try to do it on a smaller level, and they've been able to raise money and have an impact. But if you're covering 100,000 patients, that's great for those 100,000 patients. but there's still 300 million other people left, that aren't going to participate. And so that in and of itself is the biggest challenge. And the second is, most entrepreneurs, myself included, if you're just, building your net worth and you get an offer to get acquired, you're going to get acquired, and so, those companies that may build up to 100, 200, $300 million in premiums, and they get multi-billion-dollar offers, good chance they're going to say yes. And while it may not be by definition antitrust, it certainly is, stubs the toe of the best pricing and best practices.
So what are some of the things that people can do? We've talked to some pretty amazing people who have made progress in pricing in their own arena. We talked to a woman who handled benefits for the state of New Jersey, and using reverse auction, she actually saved more than $1 billion, which is something that everybody can use. But what are some of those other things that if they're not able to, invest in a huge company that can make these tremendous strides that you are, is there anything that the normal person can do?
Yeah, you run it, wherever impact you have, you do it like you're about to go on Shark Tank and pitch to us. You want to run it like a normal business. And what happens is that, with lobbying and everything, the incumbent industries do everything possible to prevent that. But, like in New Jersey, like in Maryland, like in some other states where they've opened things up or they've set pricing, there are significant opportunities, but it all starts with transparency. And enforcing that transparency. Like if a hospital doesn't show their prices, it's supposed to be $100 a day, maybe $1,000 a day. They don't give a shit about that. That's less than it costs them to deal with it. And so, there's got to be real enforcement that takes place as well. It's just such a game that gets played, and it's so unfortunate. Hopefully, it would be tough just to start hospitals from scratch and have them grow to scale. But if you look at Canada, right, there's a lot of arguments to be made why our system is better, but Canada does some basic things that I think are really smart that in turn could be negotiated to get lower prices from providers. One thing they do is they pay for malpractice insurance. Comes from the province. And that's a huge variable cost that also gives everybody an excuse. Now you want those hospitals to hire as best they can, but I think hospitals already don't want to deal with, doctors who aren't very good, right? Maybe we need to do a database of doctors who have moved from hospital to hospital for, negative reasons, but paying malpractice insurance is one thing they do. The other thing they do is all bills are guaranteed. Now the pricing is set, but right now there's a lot of gamesmanship played with charge masters and care given for the local community, charitable care provided. And so even though if someone walked in and they might charge them $1,000 because of the charge master, they're taking $10,000 worth of charitable value, and they're saying it's because they don't get fully reimbursed for everything. Well, you eliminate that game. Just set the price, and for somebody who walks in, and you pay all bills. Now, some of that happens with the ACA and others, but you make that fully available. And the third thing that I think is just as important, if not more so, most of the beds in Canada are 2 per room. We don't like that in the United States. And I don't know what percent, I forget, I did know at one point, how many hospital rooms have 2 beds. But I know I was in Canada and I had a kidney stone, and I was in Toronto. And I waited like everybody else. And I had a roommate, when I was going through the whole thing, and that was fine. I don't care, but you're setting a precedent where, for any hospital of any size, you have to have some percent, 50% of your rooms have to have 2 beds. Now, all of a sudden, their costs drop, and they have every opportunity to charge less to the patients that are using beds with roommates. And so those are the types of things that aren't overwhelming, that won't cost us a ton of money, and will have significant impact.
Wow, Mark, that's unbelievable. You brought up Canada a few times, so I feel like maybe on my final question I should go there. You know, it's amazing the results that they get in Canada, and ultimately it comes back to the single payer system, which so many American capitalists are deathly opposed to. So is this ultimately just a political fight that we're never going to win, or is there a way to disrupt that status quo as well in terms of how do we ultimately get to that?
I don't know that single payer is the best option in this country, simply because, like, I was reading Representative Jayapal's proposal for single payer, and it starts with the Secretary of Health and Human Services will do A, B, and C. Well, the Secretary of HHS changes by administration, and they come and go, and so you really put a lot of power around single payer or lack thereof in one person's hands, and it could effectively turn it into a political position. Just like the last administration really did all they could to disable the ACA, you would see someone come in under a not friendly administration and try to disable it. So that's part one. Part two is, it's not right that your tax dollars go to pay for my healthcare. Now, some people would argue we both should get, all of us, everybody should get the exact same healthcare. And I'm fine with that, but I think it should be a hybrid system, if you will, where that is means tested, so that, let's just, to pick numbers, under 2x of the federal poverty level in the United States, your healthcare is free. Right? Above that, and you just pay your normal taxes and everything. Above that, it's on a means tested basis. So if, the federal poverty level is, for a single individual is 25,000 a year, and you make 50,000 a year, or let's just say you make $60,000 a year, then based off of an indexed means testing, you pay no more than 2% of your income in additional taxes to cover your healthcare. Okay. And then above a certain amount, you pay all of it at pure cost, at fully encumbered cost. This way, the people who need it the most, that are most vulnerable, have all their health care paid for. And there's also enough interest in offering high-end services to somebody with more income, so that if I want concierge medicine, okay, I can get it, and it's worth it to the hospital potentially to invest in that, which also gives you a differentiation from Canada, where the United States kind of acts as the concierge healthcare facility for the country of Canada. So I think that kind of covers all those bases potentially, because you never know until you know, right? The best laid plans. But I really think it should be indexed so that the people who need it the most, it's free, and everybody else up to a certain point gets it indexed on a means tested basis, and and then anybody can pay direct if you want. So if the person who's at 10% or is at making $15,000 a year has got a rich uncle, or has got a job that has great insurance, right? Because you wouldn't get rid of insurance, you would just have them compete. Then great, let them go to the highest end doctor that they can afford, because you want the incentives for high quality care and technology, etc. So you asked, I'm sure you regret asking, but now you know.
I love it. No, thank you.
Well, for my final question, I'm going to bring it back to costplusdrugs.com and find out where you hope that this is going to be in the next 5 years, and how you hope that it might change the face of healthcare. Small question.
First, everybody, listening, go to costplusdrugs.com, sign up for an account, tell us if we carry it, buy from us. If we don't, tell us what prescriptions you need, what medications you take, and we'll send you an email the minute we add them. Like I said, we're looking to add 2,000 plus drugs by the end of the year, including name brand. But the goal in 5 years is to be making as many of our own as we can, to be the low-cost provider, to have actually lowered our prices so that hopefully we're doing such high volumes, instead of cost plus 15, it's cost plus 10, and to completely have turned upside down the whole drug pricing mechanism in this country and maybe outside this country as well, so that all those vertically integrated companies that have, created the distortion have no choice but to respond and to try to match what we do. That make me a very happy person.
Thank you so much for being here and talking all things healthcare, and especially all about your company, because it's really disrupting the industry and it's impressive.
Well, we're trying. Thank you, Stephanie. Thank you, Dr. Gupta. And you can follow us on Twitter and all social media at Cost Plus Drugs.
Thank you all for watching.
Thank you, Mark.
Thanks, guys. Really appreciate it.
We'll talk to you soon. Bye-bye.